to this community forum. It was a sign of our community that when we signed you all in, we didn't need to add contact information for just about any of you. We have you all in our hearts and our database. Thank you very, very much. Your support means the world to us. And I'm going to turn the mic over without further ado to Olivia Sweetnam, who's our CEO as of July 1st, and just has been amazing at the helm of Grace Cottage. And we look forward to hearing everything she has to say about Act 167 and the Green Mountain Care Board. Olivia.
Hi everyone, thank you so much for coming out tonight. I know everyone's busy and has busy schedules and we're here on a weekday night, and I appreciate everyone coming out so very much, so thank you all. As Andrea said, I am Olivia Sweetnam. I'm the CEO and the Chief Nursing Officer at the Grace Cottage. My background is as a nurse and a nurse practitioner, and I've spent about 15 years in hospital management, and I can say for certain that this is the best hospital clinic that I have ever worked at. I've worked in 3 different sites in Canada, so I think I can say it with confidence. Before we kind of launch into the content here, I just wanted to make sure that we introduce a couple of people in terms of our leadership team, so you know who they are. The first one's sitting there in front of me. Crystal Mansfield. She is the leader of our Fearless Rehab, inpatient, outpatient, and all of those incredible PPs and OTs. I see Jen in the back. She leads our HR department. Heather leads our quality department. We have Deb from finance. Mom is trying to get out of her chair, but she can't. She's one of our hospitalist physicians. And who else do we have? I see Claire, who does community outreach. Chris Boucher, who's our COO and CIO. Oh, Steven, another one who might be trying to escape. In the corner over here, we have Steven, who's our Chief Financial Officer. If there's anyone else here who works at Grace, we have our, yes, of course, we have Andrea, and then we have Jen Zweig, our new Chief Medical Officer. You might know George, our past Chief Medical Officer, tried to retire, he was unsuccessful, he was still as a hospitalist and seeing EP patients as well. I know we have a couple of others, Dana from purchasing, we have a couple of other employees kicking around here. Thank you guys so much for coming. I really appreciate your support as well. So, I don't normally talk with notes, but I feel like I have so much to make sure I cover. You'll be seeing me look down a few times at these guys. I also wanted to introduce some of our legislative counterparts who are here today. So we have Emily Wong, thank you for coming and joining us. We have Maura Ciplia, she's sitting right here. We have Nader Rashid here as well, and we have Wendy Harrison. So thank you guys all so much for coming.
I represent Brooklyn.
We also have Michelle. Awesome. Okay. Thank you. So before we really kind of get going into 167, you know, what we call it, I wanted to really just talk for a few minutes. Is that right?
Speak up.
Okay, we wanted to talk for a few minutes about some of the incredible success we've had in the last year. So we're on the fiscal calendar year, so we're technically in 2025 at Grace Cottage right now. But when we ended 2024, many of our departments had their busiest year ever. So that starts with our emergency department. In our ED, our volumes were the highest that we've ever had. You might be confused by that because every month our work shows the All-Ryan report shows our volume going down. When we looked into that data, it was because they were only Vermont primary residence homeowners. So as you know, we're the second homeowners, we're the tourists. So trust our that, it's better. And we know that it's one of our busiest years on record. We not only had a busy year, but when I look through our patient and family member response cards, we have still managed to provide that incredible quality care in our ED. I know many of you here have been to our ED, probably didn't want to be there, but you ended up there. So I know I'm preaching to the choir, but truly low wait times, exceptional care, so we're really proud of that. Our outpatient rehabs, has done a 20% increase year over year for the past 2 years for outpatient rehab. Why? So this summer, there were some days where Crystal was seeing more than 70 patients a day on the outpatient side. We were calling it outpatient rehab because they were doing rehab in the garden and in the parking lot. She has an incredible group of therapists who are skilled at, they're incredible OT, PT, and they have, interesting subspecialties too, including like pelvic floor therapy. I have an interest in that, and I think as we talk about maternal health in the state of Vermont, it's something special that we offer. I think they're an incredible team. So we're really excited to announce we have a new outpatient facility that will be opening. Some of you may know that we realized that we were not utilizing the space to the best of our ability. We had an admin office that was larger. So what we're going to do is do a nice flip. So, okay. We're going to really do that. Yeah. So at the end of November, early December, we will be moving into a new rehab space. We'll have one extra therapist as well, and we're incredibly excited for that new therapy building. Outpatient rehab, primary care, also incredibly busy in primary care. As you all know, you probably have heard, we are extremely excited about our new clinic. So this new clinic is now 50%, more than 50% fundraised, $20 million cost for our new clinic. We're about $11 million now, so we're very excited about that. Act 250 is in, send all of your positive feelings to the Act 250 spirits. We're very excited about that. We really feel like that clinic will be a representation of the skill set, the incredible skill set, experience that our community and providers deserve. Like, we deserve that beautiful new building that will be able to care for our community. So we're very excited about that as well. I would also say our MVP pharmacy, the Central Valley Pharmacy, many of you probably use that. I gathered this data today, and every time it kind of blows me away. On average, we do 5,600 scripts a month, over 200 a day. Many of you have probably been in that building, and I'm not sure how that works because they're such huge staff and they're in such a small area. So an incredible service to our community. I mean, I live in West Brattleboro. That Walgreens pharmacy, has struggled with staffing, the hours are inconsistent, and who has tried to call Walgreens and actually like a human person? It's very difficult. And I think you see, if any of you, fill your scripts here at MVP, you can talk to a staff member who cares about you, who probably knows you, and you get excellent service, and they do a really great job. So we're proud of them as well. And all of our support staff, truly, we have an incredibly dedicated team. On our inpatient service, I just wanted to point out something very interesting. Let's see if Mike will let me get over here. It's almost like they knew we had a town hall today because data came out today about quality reporting in critical access hospitals with sleep bed programs. So I think it's very confusing if anyone has read the Oliver Wyman report. It talks about our inpatient volume, especially acute beds. We have very, very few acute beds. Now I'm looking at Chris Doherty here, who's the CEO of BMH, and thank you so much for coming. But BMH has many, many acute beds. We do primarily swing. That is intensive rehab. These are patients who are here post-ortho, deconditioned from cancer treatment, and Crystal's team works magic on them. They probably curse at them sometimes. Overall, they end up leaving Grace Cottage in a much better place. And this new report was from over 200 critical access hospitals over 29 states. And it showed just that. It showed that on average, if you were at a critical access hospital with a SNF or with a swing bed program compared to skilled nursing facilities, or what we call SNFs, 73.6% of these swing bid patients went back to their home, versus SNF rate of 49%, and that was through 2020 through 2022. Similarly, the bounce back, so what we call when you try to go home, you end up back in the hospital. Of this sample, it was 8% for critical access hospital patients that are in the swing program, compared to SNF's 11%, and probably some of you have heard acute care facilities often have like 11 to 22%. So we know that the quality of the care that we're providing is really strong. I mean, I could say that anecdotally, but it's nice to actually see it as objective data. Sorry, I feel like I'm touching this mic too much. Okay, so I will say, more on a personal note, I think we all feel, that we have the best hospital when we work there. I personally have 2 kids. I have Eva, who's 7.5, she'll tell you she's 7.5, 7, and Elio, who's 1.5 years. And not too long ago, so I guess it was about 2 months ago, he has reactive airway, so he has a bad cold. We thought it was, asthma and cold. And then it got worse and thought we had it under control, and we did not. So I scooped him up and brought him right in, and thank goodness, Ben Woodward was in the ED, and not only did he have a cold, but he also had COVID, and he also had pneumonia, and he also had his reactive airway. So it was a few sleepless nights for me, but it's one thing to work at a place and feel like the warmth of working there, and it's another thing to feel 100% confident in the clinical skills that we provide at Grace Cottage, and I know from my personal experience I do. I trust them 100%. So I just wanted to share that as well. I now am going to move over to the 167 recommendations. The first thing that I'll say is that there are many recommendations that we agree with. I know you're surprised to hear me say that, but there are many recommendations we agree with. Things like transportation, affordable housing, EMS coordination. We're so thankful that we have rescue here. We don't have the problem some of our other hospital counterparts do with having a reliable EMS. Thankfully, generally speaking, we're pretty consistent there. Broadband access for patients, we're able to do more telehealth, more virtual outreach. Top of licensed practice, who doesn't want that for pharmacists, NPs, PAs? We want everyone to be working at the very top of their license. And my personal favorite, EMR interoperability. So what that means is having every hospital, maybe not even every hospital, maybe every hospital and our EMS providers, and maybe our home health providers. If all of those providers were on a single electronic medical record, I would retire. So much better. But truly, we spend so much time faxing, scanning, uploading documentation, chasing down referrals. It's a huge time suck. And Bruce does mention this in his recommendations, and we would fully support that. And there's many hospital-specific recommendations we support. I will say that I'm not totally sure if Bruce understood our programs, because some of these recommendations we have implemented. So we'll focus on some of those now. He did talk about using what are called APPs, Advanced Practice Providers, in our emergency department. If any of you guys have been to our emergency department, you probably have been treated by an APP. We have majority physician assistants and nurse practitioners. And in fact, our medical director of our ED is Joshua Bloom, who's a PA, and also ski patrol, and also a paramedic. So, these are incredibly skilled clinicians. So we've done that for years. We have actually very few as a percentage of hours of our providers in the ED that are physicians. We can do that in part because of such strong telehealth programs we have. So the second recommendation was to actually explore telehealth programs, and we're like, let us tell you, we actually have many telehealth programs. So with Dartmouth, we do tele-ED. It's not just for providers. In fact, 50% of the calls that tele-ED does at Dartmouth are nurse to nurse. Hey, can you check this for me? Hey, I'm writing a code, can you help me document? Just really excellent support. We also do telestroke, telepsychiatry, telepharmacy, and this needs a name probably change, but I know Chris from a CIO perspective is looking at teletelemetry, which would be a pilot. We'd be the first place to try that out. So we are really investigating everything that we can do with telemedicine, and we're proud of that. I would also say, and I had this on the card before you showed up, Chris, but it also talks about exploring partnerships with neighboring organizations, and I have to say Chris is such an incredible partner for us, and truly is so willing to share what's worked for you, being so open about really exciting programs that you guys have going on with rescue, forward deployed clinicians, orthopedics, your new FQHC that you'll be embarking on. So we have a really symbiotic relationship. Acutes, if we need to send our acutes, they go to Chris. Ortho, onc, come to us for our swing bed program. We both are very busy in our EDs and primary care, so we really do work closely together. We are also looking at the group purchasing program that Chris and colleagues started in the state of Vermont, backed by Ovation. So we're excited about doing due diligence on that and perhaps joining them for that group purchasing agreement as well. And then I will have to say, Bruce did also recommend continuing to develop our primary care practice, and in fact was very supportive of our new building. So we are happy, that all of those kind of project plans or current processes underway were really solidified and encouraged. The recommendations that we do not agree with, and I will say firstly that I think it appeared clear to everyone that these were kind of copy and paste recommendations. The major restructuring group kind of got the same recommendations across the board. So some of those include inpatient psychiatry. So memory care or geriatric psych, something like that. I would say first that we have an excellent psychiatric facility, not too far away from us, who has a certificate of need in with Green Mountain Care Board right now to expand inpatient services. We would much prefer they do that, considering they have all of these psychiatric nurses and psychiatrists to actually do those services. It would not be appropriate for us. We don't have any of those clinicians, but more than that, we don't have psych-safe rooms. So psych-safe rooms are actually quite intensive. There needs to be no ability for a patient to be able to self-harm in the room, and it's amazing what can be considered harmful in a room for someone who's quite motivated. So we would need major retrofitting in order to create a psychiatric facility. We do not believe that this is a good recommendation for us. Let me also reiterate, these are recommendations, not mandates. Green Mountain Care Board, AHS does not have the ability to say, you are now a psychiatric facility. So I just wanted to reiterate that. The next is a rural emergency hospital designation. You guys may have heard that as well. As it is currently written, rural emergency hospitals, you cannot include a 340B drug program, and you can't include swing beds. So what that would mean is if we became an REH, we would lose the community pharmacy and we would lose our inpatient swing population. There's current bills written that would include both separate bills that are hoping to include 340 as well as swing beds. If that's the case, we are going to be the first people to look at that and see if it's a good option for us. But as it's written right now, it's a non-starter. There's also a recommendation to reduce our emergency room into an urgent care facility and do 16 hours as an urgent care facility instead of a emergency department.
No.
You don't agree with that. Well, I think this really does bring up the data integrity issues, right? Like, I think if you were Oliver, Wyman, Bruce, and you looked at dwindling volume, sure, but if you're not including people who rent, people who have second homes, people who are tourists in the area, a third of our volume's at night. And generally speaking, if you're coming to the ED at 3 in the morning, there's something you need sorted out, like right then. So, we firmly believe in our emergency program and the value it provides. And again, I had a note about, but I think we've already covered this in terms of how Chris and our hospitals work together in terms of making sure our acute patients that are appropriate are going to Chris and we're taking their swing patients. So I think Bruce and his team were pretty confused about what acute volume is, and shifting those to other hospitals when they don't have some benefits. I would also say that we were not included as a rehab center of excellence. Those slides were just, had an asterisk, like to be discussed. I don't know how they determine centers of excellence. There's not really much data on how that determination was made, but I would state very strongly that I believe that our inpatient and outpatient rehab teams would deserve that center of excellence. Absolutely, I think that's what we're known for. And in fact, one of the Green Mountain Care Board's members is a therapist who is nowhere in the area, and at our last budget meeting actually said, you know, your reputation precedes you, and we appreciate the therapy and the type of care you guys provide. So, yeah. So I think, I promise I'm gonna cede the microphone some point soon, but Devin is here. Hi, Devin. Thank you for coming. Devin is with WAS, the Vermont Hospital Association. They've been a great partner for us through this entire process, but they just released an economic impact for every hospital, I think, perhaps.
The four
major.
hospitals so far we work with major pro.
Cool, thank you. And so, really interesting, I have that here if anyone would like to look at it after, but essentially, you know, we have 220, 230 jobs here at Grace Cottage, indirectly support about 400. If Grace Cottage Hospital closed, though, the unemployment in Wyndham County would jump by 36%, and it would make Wyndham County one of the highest unemployment rates of any county in Vermont. And furthermore, every dollar spent by the hospital is $2.30 spent in the community, spent in our community. We spend $30 million a year operationally, and $20 million of that is salary and benefits. So people who are paying rent, mortgage, going to see movies, you know, going to buy groceries here locally. And I would also just say, this is something that really frustrated me about our report, all of our reports, is the assumption that that hospitals needed to be subsidized, that we had negative operating margins, and it's true. We do have a negative operating margin. We're working really hard on that. It's been the case for many, many years. We thankfully have usually $2 million in philanthropic giving that comes to us every year from our community. So thank you, because that is you guys supporting us. That's in addition to the $11 million fundraised for the clinic. We pay about $1 million in provider tax to the state of Vermont. There's a federal matching program where we get about 1.4 back from the federal government. So in fact, we support the state Medicaid program about $2.5 million from Grace Cottage alone. So we're not asking for taxpayer money to bolster up, you know, the hospital. I think that was kind of how the report read, how it was inferred, and we just want to make sure that that's clear. My last part here. I will say, Green Mountain Care Board, as I mentioned, you know, they don't have an ability to say, you guys are doing this now, you must do this now. But what they can do is issue extremely unrealistic budget orders. So they have the purview of approving hospital budgets. This year, our budget was denied along with many other hospitals, but really have issued some pretty unrealistic orders on expense reduction. So we're working through that process right now. But I have to say, aside from that, we have many operational improvements we're really excited about. We're looking at all the equipment, expertise, software that we currently have, and we're building from there. We're now going to be offering low-dose lung cancer screening, which we're excited about. We're looking at different ultrasound procedures we can do. We'll be starting an LNA program with Bradley House and Valley Village to do pipeline development there, especially with our high school right down the street. And of course, we're very interested in Chris's program with Rescue. We're meeting with Drew to talk more about that as well as with Chris. So all that to say, really in summary, I think what we need from you all is your support, which you always give us. And thank you so much again for coming out tonight. But to really echo the message to our legislative counterparts here of why Grace Cottage is meaningful to you, why it's important in our community, and also that we need more accountability and responsibility from the Green Mountain Care Board. You know, this has been a really hard process with these reports, and the budget process has also been really difficult as well. So I would say we're looking forward to the future. I think it's really, really bright here at Grace Cottage, and this is just the hurdle we're getting over right now. So I'm going to give the mic away now. If anyone has any kind of comments or questions, or if you just feel like sharing your Grace Cottage story, that's fine too. Oh, I already have a hand. Okay. Thank you guys all so much for listening to that.
Thank you. My name is Bill Dunkel. I live in the town of Wyndham. I have some friends here that are Wyndhamites. Probably everybody here knows where Wyman is, but in case you don't, you go north on Route 30, 6 or 7 miles, turn right at the West Townshend Post Office, and go uphill 6 miles to Wyman. We have fewer than 500 people in our town. If we have a medical emergency, a life-threatening emergency, it's possible to get to Grace Cottage in 20 minutes, maybe a little bit less. If we cut back those hours and we have a medical emergency and we can't come here, it could be 40 or 45 minutes to get to Brattleboro, which is a great hospital. I have a great cardiologist there. Or to go to Springfield takes a long time, and that's under the best conditions. If it's winter and we've got icy roads coming 6 miles down the mountain, it could take much longer. So for one, as a person who's been served by your emergency department, I am really concerned about that, and the fact that could cost a life. You know, that could cost a life, and I hope the Green Mountain Care Board, I don't know if they know anything about the topography around here, about where the towns are, they just kind of did this in the abstract. But I would hope they would have taken into consideration real life situations like that in making that recommendation, which I hope will not go through. Thank you.
Thank you so much for that. And one other point you were just making me think, I should mention, what you'll see if you look at this report is that there's no implementation analysis whatsoever. There's no actual data of, so if our ED closes, what actually is the travel time? What's the financial repercussions to our neighbors? Is the capacity, like is there actual capacity for people, for the current volume we have, the right current volume, to go to another ED? So it's a point very well taken. Thank you for sharing. Hi. Might have to speak over there. Oh, I'm sorry.
It's fine. No, I'm a very recent recipient of your care.
Oh,
So it's part of why I came out tonight. But
yeah.
sort of new to the area. So my question is, I don't understand this Green Mountain Care Board and why we care about that. It's running the budget, and if the private giving covers the deficit, I mean, I certainly been in business long time, deficits are bad, but if you have other sources, so why do they even get a say?
Thank you for your comment. Yeah, so to be totally honest, I'm Canadian, I didn't mention that. And so I'm used to working in different models, single payer systems, I've worked in other states. I have not experienced anything like a Green Mountain Care Board before. And I understand from Stephen, they originated in the 70s, 80s? Early 80s. The rendition.
Same process.
Yeah. The Green Mountain Care Board in its current form acts as kind of a, what do you call it? They act as a policing agency for hospital budgets. They approve hospital budgets every year. They, I think, consider their mandate to be to reduce healthcare spending in the state of Vermont. Their instrument is very blunt. All they can do is approve or deny budgets and kind of make determinations on your net patient revenue, for example, not to get into the healthcare finance weeds, but a very, very blunt instrument. So that's why we care, because there's penalties and fines, percentage or dollar amounts if we don't comply with the budget order. Interestingly, the budget orders, I think this year, have been astronomically different than previous years. They've also been met with incredible resistance. So like UVM, for example, issued a very strongly worded letter about the fact that they would have to start reducing programs and services, and in fact, threatening to shut down their dialysis program in order to meet the budget order. So the budget orders come out as just a dollar amount or a percentage of net patient revenue without actually looking at utilization or kind of needs in the community. So it's very frustrating. You would know so much. Do you know?
I actually don't think anybody can answer that question. You know, they have a purpose, I'm sure. I like to think of them a benevolent antagonist. They make you think in a different way, I guess. But honestly, they truly don't have a whole lot of healthcare expertise, and I think that's problematic because healthcare delivery is incredibly complex, and I do think that it's a challenge to try and educate people on the complexity of healthcare. When you look at something on paper, I think the thing that bothers me the most is that yes, there are charges to make accessible, affordable healthcare for all Vermonters, but also high quality. And a story like driving 45 minutes, even to the best hospital in Vermont, for emergency room services, that's not high quality care, I'm sorry. That's just not the way to do it. And I think the focus on high quality has been lost for some reason, and I'm not sure why, but all I can say is you all are very lucky to have Olivia here because you've got the right person to lead through this time.
Devin might be.
Yeah,
Devin Green from last.
you're making me answer about the agreement.
Yeah. Come on up to the mic, Devin.
I didn't realize this, you might get called on me.
Aren't they overseen by the legislature?
Yes.
Why not the legislator ought to be able to?
So the Green Mountain Care Board in its current iteration, Stephen's right, hospital regulation has been around for a long, long time. And I will say that our hospitals support regulation. We live in Vermont. We live in a state that has chosen to have nonprofit hospitals as its system and to carefully regulate that, and we appreciate that. And so we do understand the need for regulation, and we appreciate that. We're looking for predictable, we're looking for, very thoughtful regulation. What we have now is a lot of unpredictability with the Green Mountain Care Board. It was started originally during the single payer push, and the thought was that this would be the regulatory agency that set rates for our single payer program. Things have since changed since then, and I do think an evolution is needed and another look as well.
So I'm one of those cases, I broke my neck late at night, late January, many years ago. And thanks to the Jamaica Volunteer Rescue and Grace Cottage, I got excellent care and was stabilized before I went to another hospital. I also work for a nonprofit in prevention of substance misuse. And we have noticed that so many independent pharmacies locally in the mountain communities have been closing, and this has a great impact on working families here, trying to get what they need.
Thank you so much. Thank you for sharing.
Full disclosure, I'm Bucky Wilson, and I have the great fortune of being Dr. Otis's son-in-law. And so I've, over the years, quite a number of stories with respect to his practice at Grace Cottage, and in connection with the gentleman's comment about why we care about the Green Mountain Care Board, I have a little story for you. I'm not sure if it was in the current Green Mountain Care Board structure or if it was a predecessor. But anyway, it was at a time when they had to present, as they do now, their annual budget to the organization. And Grace Cottage, being a somewhat smaller hospital than some of its, than all of its colleagues the budget fairly quickly and had some time left over. And one of the people on the board said, Dr. Otis, I am very much interested in how it is that you are able to keep that little hospital going. And his reply was, that's none of your damn business.
It sounds like the greatest impact or threat is the budgetary from Green Mountain Health Board. My question is, what can our legislators do to help us in this process, and what would you want from us to help?
Yeah, that's a great question. I think maybe two parts actually. I think the recommendations, we really didn't talk about this, but I'll say this briefly. The recommendations as they currently are kind of stagnant, and they were commissioned with taxpayer money by the Green Mountain Care Board. The plan is that next they will move to AHS, or the Agency of Health and Human Services in Vermont, who currently have an RFP out for another round of consultants who will do impact analysis on the first round. So I was frustrated when I initially heard that. However, I've since heard there might be some interesting players, maybe interested, who could give more context, who have more knowledge of critical access hospitals. So I'm hopeful, I'm remaining hopeful. And that will kind of be the implementation analysis phase. So you're right, like we're not concerned really with the Green Mountain Care Board kind of enforcing any of these recommendations. It's not under their purview. We are, however, concerned with the budget process and these very, yes, I keep saying a blunt instrument because I don't know the better word to say it. Like a budget order is made without any kind of nuanced consideration of the services provided or how it will impact the patients if we need to shut down different services to meet a budget order. To be clear, Grace Cottage has no plan to shut down any services though. So we're in that process of doing budget reviews, reviewing every single department to see where we can where we can save, to be as lean as we possibly can. I think the message though, as Devin said, is that we really do need people to start voicing concerns that is it time to reconsider what Green Mountain Care Board is, what they do, their members, the constituents, what their purview is, what the goal is, because it feels like we've gotten quite lost, and it feels like the recommendations and work they're doing more recently is actually not helpful. In fact, I would say it's detrimental.
How would we go about doing that?
You contact.
We happen to have a sheet back there that has all the emails, and it also has QR codes if you want those, for all the legislators that serve Wyndham County, and also for the Green Mountain Care Board. They have a public comment section, and you can go right to their website. Everything on the Green Mountain website, everything they do is transparent, which is a great thing. It's not always the same with the Agency of Health and Human Services, but the Green Mountain Care Board does have complete transparency. So you can go to their website and make a comment. Some people have. I think Roger Albee did. Other people, Mary McCoy did. Thank you, Mary. So you can do that. And also Governor Phil Scott, we have his address up there. And the State Treasurer, Mike Pichek, who's a great fan of Grace Cottages, and we'd love to hear from you. The more you speak out, the more you'll be heard, and we need that so desperately. You paid $5 million for all of this to happen. It was approved by the legislature, then it was given to the Green Mountain Care Board and the Agency of Health and Human Services. So that's where your money is going. And today I have the unfortunate job of calling or emailing all of the newspapers that we do advertising with to say we have to cut our advertising because we have to cut this money from the budget, and this is going to be the first thing to go. So the economic ripple effect is already taking place, and it scares me for our county, it scares me for our patients. It's really not, I think there were unintended consequences to this report, and now they're starting to come out.
I think, I can't remember if I said this, but message. You may have heard Bruce today on Vermont Public Radio. Did I mention that? Okay, so Bruce has just today, yesterday, come forward and admitted there are many errors in the report. He still thinks directionally it's correct, but there are many errors. And that reporting was based on one hospital who submitted directly, I think, to VPR. We had many data integrity issues. We sent those directly to all of Wyman, and it sounds like we should have sent them directly to the Green Mountain Care Board, so Devin is working on that as well, but I think there will be much more to come on that.
Can I have one? Should have sat in the back. I do want to I don't want to turn up the temperature so hot against the Green Mountain Care Board. I think they have a very difficult job. They're really trying to walk a fine line between creating affordable health care for Vermont and maintaining that access and quality. And so we appreciate how difficult their job is. I think the most immediate ask to legislators is to ensure that as we move forward, this is not something that the Green Mountain Care Board can do to us through their budget process. We don't want them to implement these changes by saying, oh, your inpatient is X million of dollars, and that X million of dollars is coming out of your budget. They have said repeatedly that they cannot implement these changes, but we would love that to be put into action through legislation. So that would be the immediate ask going forward.
This is why what a great point, yes. Exactly.
I just have a quick comment that having worked at Grace Cottage and also had experience at a number of other hospitals, Grace Cottage is some things so well, they're so basic that it's like a foreign language in a lot of big hospitals, patient education being a huge one. And good patient education is not only critical for patient outcome, but also for cost. If people know what is expected of them, know what they have to do, you're not going to see them again. They're going to take care of their own health. But my question is, I haven't finished reading the report, but as I read it, please correct me if I'm wrong, it seems like most of the increase in cost is focused on the big hospitals. Fletcher Allen and Dartmouth, and they're affiliated hospitals. Why are community access hospitals then being the focus of care reduction? To the extent that, a major impact on our budget could possibly close Grace Cottage. Thanks.
Yeah, they're great questions. I think this report, if I'm holding 167, the final report, I think it's more than half of total healthcare costs are at UVM or Dartmouth affiliated hospitals in the state. So yes, I think that's absolutely true. It's true. I don't know why. I think again, it's a kind of a blanket approach. I think when we see recommendations, I didn't even touch on ambulatory surgery. Oh my gosh, what am I doing? So when we see blanket recommendations, one recommendation I did not mention was ambulatory surgery. That was a recommendation for Grace Cottage. It was a recommendation for each of, I think, the major restructuring hospitals. I would like to remind everyone here that we have no anesthesiologists, we have no operating rooms, we have no sterile processing, we don't have the equipment, we don't have OR nurses. And when we talk about kind of healthcare access and quality, we would, in healthcare we call it high risk, low volume. You never want to do a type of surgery as a hobby, like a high risk surgery. You don't want to do it once every 6 months. You want the right people to be doing the right type of procedures. No one at Grace Cottage thinks that we should get into the ambulatory surgery business. It's hard to understand how that recommendation even made it into the final report. So some of those recommendations, like it feels like there's just been a blanket application of, what someone at Oliver Wyman read, and just we're trying to blanket, across. So I don't have any really great answers why it feels like there's a lot of focus on smaller critical access hospitals, and we are such a small amount of the total spend of healthcare in the state.
Less than 1%.
Is that true? Less than 1%.
We're Grace Cottage, or can we get?
Grace Cottage.
Are there figures available? I'm sure there are, but could you point me in the right direction to find out, some sort of comparison of administrative costs for one hospital to another? Because I think that's another area that, I think they pointed out that the larger hospitals have higher overhead. And just to point out again, the absence of knowledge of healthcare demonstrated in this report is pretty appalling. They call out research at the large hospitals as being perhaps not geared to the immediate needs of Vermont residents, and that's kind of not how research works. So.
Yeah, no, absolutely. I think we, there are just a lot of those types of recommendations, ambulatory surgery, but even hospital at home, like the current reimbursement programs for critical access hospitals actually can't do hospital at home. There's, potential in the future, but a lot of the recommendations, it clearly felt like there was a great gap in knowledge of rural health clinics and critical access hospitals specifically. The first part of your question,
Administrative costs?
Oh, yes.
A place to compare.
I don't know if there's a comparison of administrative costs. They talk about administrative costs like in 167, but I don't know if there's like a comparison tool.
I mean, you could find it in the hospital, but it's something you might get. You would have to dig around.
Okay.
Yeah. We can try to
Find, yeah. Thank you.
It isn't. I'm just gonna add another thing on the critical access hospital piece. So Grace Cottage is a critical access hospital with something that was started to ensure that rural communities have access to care. And Vermont is really unique. It's actually the most rural state in the nation, according to the US Census. And that's because, unlike Montana or other places, a lot of their population is concentrated in their cities, while our population is really spread out amongst the state. And so critical access hospitals serve a very specific purpose, especially in Vermont, and that shows in our average daily census. That is the highest in the nation amongst all other hospitals. So again, it just goes to the importance of access to care in rural communities and the purpose that Grace Cottage serves.
And I want to say something very important, which is that our legislative delegation knows us, and they're always so supportive, and we have them watching our backs, and we're very confident of that. It's something that we always treasure and don't take for granted, because I've talked to my counterparts at other hospitals throughout the state, and they're not sure that their legislators really understand them. So we know we don't have that. So thank you very much.
Andrew's trying to peer pressure someone.
Sorry, I didn't expect this again. It's been 2 years. Andrea, I was riding my bike September 27, 2022. Riding my bike September 27, 2022. Down in Birmingham to start with my brother and a group of friends. And I never saw it coming at me, but a car came from the right across the yard and gardens and trees, and it took me out and was helicoptered to the trauma unit down in Bay State. And spent a week and a half there, probably one of the hardest week and a half of my life. I broke 27 bones, and let's see. My husband, I didn't really know Grace Cottage well. I had a doctor in Brattleboro, and he said, you need to go to Grace Cottage. And I wasn't in a very good state to disagree. I really trust him. He had a lot of experience with Grace Cottage. And rescue also played a big part of getting back and forth the various operations. But rescue got to Grace Cottage, and I remember coming into the room and thinking, if I had known my grandmother, this is what the room would look like. I mean, it was a soft pink, the bed was welcoming. I had come from a pretty tough trauma unit where I couldn't even see the sky. And people would get my meds and not get my meds. I know they were working really hard. It wasn't for lack of caring. They just, I'd be waiting all night for meds and I was in a lot of pain. So Grace Cottage, within, I'd say, the first 2 days, someone came in and said, would you like to have a therapist as part of your wraparound program? We know that depression can be a big part of what you're going through. And it was just like, oh my gosh. So I had a therapist. I couldn't move any body part. I had 2 fingers that worked. I remember PT would look at me and say, we don't really know what to do with you. I didn't tell you that, but it was great. But anyway, I'm making a long story longer. I remember the guy, the cook from the kitchen came up. I broke my jaw, and so I couldn't have any solid food. I was on liquid for 6 weeks. And he just came up and said, what can I do for you? How can I, what do you want to eat? I was blown away. I had PT, OT, coming in, working on different splints. I mean, everything was custom. It blew my mind. The nurses, I had to be lifted to go to the bathroom, all those wonderful details, things I never thought I would experience. And these people with grace and humor every single day. And I was humbled. I couldn't thank them enough. Andrea, it's just amazing. I never felt so much love from people I didn't know. It kept coming at me and I didn't know what to do. Just take it. Even though when I cleaned my room, she hung all of the cards I had received. I came back from, being out on the little porch, and all my cards were hung on the wall. So it's a place that I'm in love with everybody there, and it will be a forever thing for me. They reached out to me in a way that I have never ever felt in my life. So I'll do whatever I need to do. And it's wonderful, hearing your knowledge and expertise and commitment and care. So I think that's the biggest thing. That place is so filled with care and love and expertise. And I'm in Milwaukee thanks to all of their help. And, you all were amazing. I couldn't have done it without them. So it was 2 months of lying in bed, and I couldn't leave till I walked. And Mike, the PT, got me out standing for 10 seconds the first time, and went from there. So I want them to stay.
I echo that sentiment. I've never felt anywhere with so much love. Like, it truly is, it permeates everything. And my own personal story, within 2 weeks of starting, no one even told me about this. I heard about it when I was wandering around the unit. We had a patient who was coming in for infusions. She's outpatient. But she was newly in a wheelchair. And she had to call for a ride, but then she had no wheelchair ramp. So people were having to carry her to the car. And it just felt so, almost stigmatizing her. It just didn't feel good. And she was telling the nurses about this when she came in for infusion, this is just how much it bothered her. And by that afternoon, our scheduler's son and our charge nurse's husband had built a ramp at her house by that afternoon. And I do feel like that's the kind of love that happens at Grace Cottage, but also the type of action. People see a need in the community, and patient, someone they newly love, they may have met them for the first time that day, and their action and their care is just, it's remarkable. It's incredible. It really is. Any other comments or really anything?
Thank you for bringing it to our attention.
We really want to stress that we hope that you will follow up because you are the reason that we're here. And what we can't quantify is how we improve people's lives, just in the ways that have been told tonight. The lives we've saved, the lives we've improved. You can't put a dollar amount on that because you don't know what it is. So to reduce Grace Cottage to dollars and cents takes away our essence. And so we'll keep on doing what we're doing. We've been doing it for 75 years. We've hardly ever made money in 75 years. Nobody would ever want to take us over because we don't make any money. But we really, you can tell as you walk around the hallways, every single person there, every employee has a passion, a commitment, a caring. It's the strongest culture of any hospital. I'm prone to exaggeration, but it is the strongest culture of any hospital that I think you'll find anywhere. And it's a treasure that we all need to preserve. So thank you all for coming tonight.